With that, I call on Jackie Baillie to speak to and move Amendment 16755.1 around 7 minutes. Ms Baillie.
Thank you very much, Presiding Officer. On one level, it is disappointing we're having to have this debate. It is undoubtedly because the Scottish Government has failed to provide leadership. It has allowed the lack of clarity about the protection of single-sex spaces to continue. And whilst the Scottish Government amendment asserts that they follow the law, this contradicts people's experience. There are examples in the public sector where the SNP have allowed practice to get ahead of the law, and some people assert that this was encouraged. So let me be clear. Single-sex spaces based on biological sex are protected in the Equality Act. Women and girls have a right to feel safe in our public buildings, especially in schools and in hospitals. These are places they attend because they're required to do so by necessity and often at moments in their lives where they may feel vulnerable. Schools should be warm and welcoming places where all of our young people can thrive. But they're also a microcosm of some of the behaviour women experience more generally. A 2022 survey by the University of Glasgow found that almost two-thirds of pupils at Scottish secondary schools have experienced sexual harassment at or on their way to school, with a third describing invasive behaviour such as sexual touching. And for all young people, the high school years are a time of physical transformation that often comes hand in hand with a desire for privacy. Schools have a duty to protect their students and create a welcoming environment for all. And that includes providing accessible and single-sex toilets so that girls of all ages feel they have the privacy that they need. In public workplaces, such as hospitals, female staff should have the right to access single-sex changing rooms. If the SNP government had kept to its statement, I'll take an intervention from Fergus Ewing.
Ewing, briefly.
I'm most grateful to Jackie Baillie, not only under the Equalities Act of separate spaces protected, but specifically under the Workplace Health, Safety and Welfare Regulations 1992, paragraph 24 of which briefly says that changing facilities shall not be suitable unless they include separate facilities for or separate use of facilities by men and women where necessary for reasons of propriety. Now, where ladies, women have to take their clothes off to disrobe to put on hospital scrubs, what greater example could there be of propriety being required? So I ask this of Jackie Baillie because the Cabinet Secretary, for whatever reason, chose not
briefly,
to
Mr.
take
Ewing. Thank you. Jackie Baillie.
That was a long intervention, but Fergus Ewing is right, and I'm surprised that the Cabinet Secretary didn't actually reference those set of regulations. If the SNP government had kept to its statement in their amendment to respect the Equality Act and those regulations, this would have been clear to public bodies and the recent dispute in NHS Fife would not have happened. How many other public bodies are not interpreting the law correctly? So the SNP government must undo the mess it has created by swiftly giving clarity. I've lost a lot of time already. By swiftly giving clarity to public bodies about ensuring the availability of single-sex spaces for women and girls. We all know that NHS staff already go above and beyond the line of duty. So our hospitals should be places where staff don't have to worry about the facilities. Their sole focus should be on the job. But the reality is that even when the SNP now commit to a clear principle, it simply fails to deliver in practice. For 20 years now, first Scottish Labour and then the SNP administrations have required health boards to eliminate mixed-sex accommodation in hospitals. Yet in 2024, only 2 health board areas, Dumfries and Galloway and Orkney, confirmed that they offered single-sex accommodation across all their wards. The remaining 12 health boards offered mixed-sex accommodation in at least some of their wards, a far cry from the pledge made. Yet the reality is that too often women are stuck not even in mixed-sex wards, but in corridors. Most of you are aware of the recent harrowing report by the Royal College of Nursing, which described corridor care. One Scottish nurse described having to use privacy screens around patients so that they could use the bedpan. As the director of the Royal College of Nursing said, This is completely unacceptable for patient safety and staff well-being. The chaos in hospitals, I don't have time, sorry. The chaos in hospitals is not just humiliating for individual patients, it provides a backdrop for an even darker turn of events. There were 276 recorded sexual assaults and 12 recorded rapes in Scottish hospitals in the past 5 years alone, according to Freedom of Information requests submitted by the Women's Rights Network. Of the 288 sexual assaults and rapes that were recorded, more than half occurred on a hospital ward. The surroundings where these, please don't interject from a sedentary position, I do not have time to take interventions. The surroundings where these assaults took place included a children's hospital, 2 maternity hospitals, a palliative care hospital. Shockingly, Police Scotland could only give details of 29% of cases, meaning that the real number of sexual assaults must be far higher. So let me make a direct plea to the Cabinet Secretary. Will she commit to urgently working with the Cabinet Secretary for Health, NHS Scotland and Police Scotland to ensure that there is more accurate recording and reporting in the NHS of sexual crimes? Can she ensure that the SNP live up to its long-standing pledge to not only end corridor care, but mixed-sex wards too? And finally, will she bring clarity in the government's actions by ensuring that single-sex spaces based on biological sex are protected for women and girls as set out in the Equality Act? Presiding Officer, I move the amendment in my name.